Now here's our reporter Laura Windsor with more on hearing loss in children.
Roger, hearing loss affects over 12,000 children born in the United States each year, making it the most common birth defect. We spoke with Dr. Nguyen Pham at Children's Hospital of Orange County to learn more about hearing loss in children.
Hearing loss can either be something that children are born with initially, or it's something that can develop in early childhood and even later in childhood. So there are a huge number of things that can cause hearing loss to develop later on. The most common in children are middle ear infections. So severe infections that damage the inner ear bones or the eardrum itself. So there's definitely a danger to those ear infections. The good thing is the pediatricians are onto it, and ear infections are treated very aggressively.
What are some warning signs parents should be looking for?
In very young infants, the things you look for are, do they look to your voice when you're talking? Or if there's a loud sound like a car backfires going by them, do they startle? In these infants with hearing loss, they're totally immune to these things. You know, as children get older, a little bit older, around 8 to 9 months, they should have some words. They should be able to say mama and dada. So if there's any delay in speaking, a hearing test is definitely warranted. And then as the child gets older, the things we look for are they attentive in class? You know, are they communicative with their classmates? Do they participate in class?
Dr. Pham tells us how a physician diagnoses hearing loss in a child.
The first thing we do is we do a thorough physical exam, and we look at the inner ear or the external ear under a microscope. So we have a magnified view of the eardrum, and we can see if there's any abnormality to the eardrum or to the ear bones behind it. We can do a quick, rough test in the clinic, but generally the next step will be to refer to an audiologist who we work very closely with. And there are a number of hearing tests they can do depending on the age of the child. If the child is very, very young, what they can do is a test called an ABR. It's a very interesting test, and it's sort of the workhorse for us. And the way it works is they place little tiny electrodes all on the child's scalp and then play noises in their ear. And what they're looking for is to see if the brain is responding to these sounds. Treatments for hearing loss fall in two broad categories. So as surgeons, we think of either sensory neural hearing loss, so that's damage to the nerves in the inner ear, or the cochlea, the organ of hearing. Or the second broad category is conductive hearing loss. So those are problems with the eardrum and the bones of the inner ear. For the sensory neural hearing loss, the treatment options are a little bit limited. The things we can do are cochlear implants, which are fantastic, and also if there's some degree of hearing loss left, osseo-integrated hearing aids, which are a more powerful form of hearing aid. The cochlear implant is a form of hearing aid that is implanted directly into the cochlea, the organ of hearing. And so the cochlea is a snail-shaped organ in the inner ear, and the way the cochlear implant works is we make an incision in the skin and we drill through the mastoid bone behind the ear and insert an electrode directly into this organ. And the way it works is the hearing aid will then stimulate the organ when a sound is detected and send the message to the brain, bypassing almost all of the structures of the middle ear.
Dr. Pham discusses what he feels will happen in the next 5 years for children with hearing loss.
The treatment of hearing loss in children has been revolutionized in the last 10 to 20 years with the development of cochlear implants. Children who grew up that would have pretty much been in the deaf community are now joining the hearing community because of the cochlear implants. It's essentially restoring nearly normal hearing in these children. And so I see a continuation of the development of cochlear implants to where we are doing them younger and younger, and these kids developing nearly to a normal level.
Identifying hearing loss in children early allows for both initial treatment and rehabilitation so they can develop normally. For the American Health Journal, I'm Laura Windsor.